Hello everyone, my name is Hadi Erfani. I'm PGY2 in OBGYN residency at Baylor College of Medicine in Houston, Texas. Um, the title of my presentation is Ovarian Cancer with Brain Metastasis at the Time of Diagnosis. And this is a surveillance epidemiologic and end result database study. I have no conflict of interest to disclose. We know that brain metastases are rare and usually late events in ovarian cancer. Understanding the occurrence of brain metastasis from primary ovarian cancer is an important clinical goal. We sought to report a series of 106 subjects with evidence of brain metastasis at the time of diagnosis of ovarian cancer. We used the data from the Surveillance Epidemiology and End Result Program, SEER, of National Cancer Institute between the years of 2010 to 2016. The inclusion criteria was primary cancer documented as ovarian or tubal, evidence of brain metastasis at the time of diagnosis, available treatment and follow-up information, and patients were excluded if they had any missing value for any of the study variables. 4 study groups were defined based on the presence or absence of lung and liver metastasis at the time of diagnosis in addition to brain metastasis. So we had a group who had brain metastasis, lung metastasis, and liver metastasis. We had a group who had brain and lung metastasis, but not liver metastasis. We had a group who had brain and liver metastasis, but no lung metastasis. And we had a group who only had brain metastasis at the time of diagnosis of ovarian cancer. Outcome variables were overall death, cancer-specific death, and total survival months. A statistical analysis was performed using SPSS version 22, and appropriate statistical methods were used. Cox regression analysis was used for the purpose of a statistical modeling. 44,112 subjects with diagnosis of primary ovarian or tubal cancer were identified between 2010 to 2016. 106, about 0.2% of these had brain metastasis at the time of diagnosis. 17 out of 106 patients had brain metastasis, lung metastasis, and liver metastasis at the time of diagnosis. 22 had brain and lung metastasis, but not liver metastasis. 7 had brain and liver metastasis, but no lung metastasis, and 52 only had brain metastasis and no lung or liver metastasis at the time of diagnosis. The median overall survival was 3 months. Overall mortality rate was 85 out of 106, which is 80.2% during the follow-up period. Cancer-specific mortality rate was 63.2%, and it was 88% in the group with all 3 distant metastases versus 51% in those with only brain metastasis. And that comparison was statistically significantly different. This table shows some characteristics and outcomes of the study participants and the overall survival months according to Kaplan-Meier analysis and the 4 groups of the study. This figure shows the Kaplan-Meier curve for overall survival months and cancer-specific survival months. In both figures, you can see the blue curve corresponds to those with brain, lung, and liver metastasis, and the purple dotted line corresponds to only brain metastasis with no lung or liver metastasis. The Cox regression analysis revealed 110% and 170% increase in the hazard of overall and cancer-specific death, respectively, in the brain, lung, and liver metastasis group as compared to only brain metastasis group. The overall death hazard ratio was 2.1 with 95% confidence interval within statistical significance, and cancer-specific death hazard ratio was 2.7. Again, the 95% confidence interval was statistically significant. Our study concludes that outcomes of newly diagnosed ovarian cancers with brain metastasis at the time of diagnosis is very poor. Almost 50% of these cases are diagnosed with either lung, liver, or both metastasis at the time of diagnosis. Therefore, we recommend full body evaluation of metastasis, including brain imaging in patients with advanced ovarian cancer. Thank you for your attention. I will be happy to answer any questions in the comment section. Thank you.